Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Good evening, everyone. So for those of you who are new, my name is Lisa Palladino. I run the Tongue Tie Experts Instagram and Facebook world. I say all the time, I hope you understand that I don't think I am the expert. I think we're all experts. And now that I've launched a podcast, every other week, I'm trying to alternate interviewing a professional in the field and a parent, because the parents are just as much the experts, in most cases, having gone through it, as are the providers who take care of families. So this week, I am interviewing someone who happens to be a provider, a nurse practitioner, and a parent, and she's got so much experience, and she has agreed to come on and share it with us. Hi, Karin. Thank you so much for joining us today, tonight, this evening, whenever you're listening.
Yes, it's 6:00 where in my time zone.
Okay, so Karin, please tell us a little bit about yourself and what motivated you to reach out to me so fast and say, Lisa, I have to tell my story.
Yes. Well, I am a mom of, I'm pregnant with my 6th baby.
Wow.
Halfway through. The first.
Congratulations.
Oh, thank you. The first 4 were biological babies. The 5th one we just adopted within the last year from India. This is our 5th bio. And the first 4 babies were all tongue-tied, and it was a brand new experience for me. I had been a pediatric nurse prior to having children, and had my women's health nurse practitioner training during that time as well, while I was working at the hospital. So I felt very mentally equipped for challenges in birthing and child raising, and it was totally threw a wrench and just made me really question if I knew anything. Because
I hear you. I say often, we just don't learn about this in school.
no,
Right?
absolutely.
There's nothing in it. There was nothing in my RN training, in my midwifery training, which is similar to nurse practitioner training. We probably use the same books.
Oh yeah.
and not even a lot in the lactation training.
Oh, really?
So yeah, we just don't learn about this in school. So how old is your oldest that had the program?
10.
10. Okay, so 10 years ago, that was right about when I was getting started.
Oh, wow.
So there was not a lot of stuff around.
Yeah,
tongue
I
tie at that
you
point.
then, because it was challenging. He induced because I had preeclampsia, and then so I was in the hospital and started trying to breastfeed, and I was very committed to breastfeeding. I did not want to do formula, just a laziness issue of like not wanting,
Yeah, breastfeeding is easier when it works, right?
Yeah, absolutely. So I was really committed to that, and the lactation consultants in the hospital were okay, but they would just stop by once a day and then ask if I had any problems and leave. Didn't really troubleshoot with me a whole lot. And I was having pain, and he was not latching correctly, but he was getting enough. So he was having the wet diapers. And then he had gained weight before we left the hospital. And so from their perspective, they said, oh, everything's fine. And I said, I'm still in a ton of
you know what? That's so common. It's so common that the only metric that healthcare providers look at it is weight gain.
Yes.
And don't consider the mother's experience.
Absolutely.
Other than the fact that it's a risk to have damaged nipples, it's a physical risk, but it's also makes your breastfeeding experience not what you expected it to be. You think it's going to be this lovely, I'm going to hold the baby and everything's going to be lovely and sweet and comfortable, and then all of a sudden it's like, ouch, right?
Yes. Yeah. Absolutely affects bonding too. I felt that single one of them, that I wasn't enjoying that time with them. Really painful, and I would cry every time I had to feed him. It was so painful. And I kept calling the hospital because I didn't know who else to call. And they kept saying, well, now you've left the hospital. We can't really help you anymore, which was hard. And I had that vasospasm, I had every telltale sign of a bad latch. But wait, the pediatrician was happy, and nobody wanted to do anything about it. So
right. And nobody suggested that you see a lactation consultant.
No.
Yeah. So you're proving my point of why I am teaching all healthcare professionals and not just lactation consultants about tongue tie, because most women don't get referred to a lactation consultant, and then they give up breastfeeding without having a good shot at it.
And they think it's their fault. Like there's something that they couldn't figure out and they failed at. Just makes me sad.
I feel sad for you. I'm so sorry.
Yeah, well, it really opened my eyes to a whole new world of lactation consultants, because I hadn't ever interacted before. I ended up finding one of my own several months in, and she's the one that looked, and she said, I think he's tongue-tied, and I think you should go see somebody. And so I asked my pediatrician, and he sent me to an ENT. The ENT said he's gaining weight. He's fine. And then told me that his wife had a baby, he and his wife had a baby that was tongue-tied and was causing her pain. And so he clipped his child.
But not yours.
But he said he wouldn't do mine because he was gaining weight appropriately and even well, but I was bleeding. He was having coffee ground stools.
Wow. So for those who don't know what that means that he was ingesting his mother's blood, and that was coming out looking like bloody stool, but it's not that the baby's bleeding, it's that he was having your blood. So somebody has a comment, and I need my glasses. Mama Iman says, I had pain and most people told me it was normal. I believe so strongly that it's not normal that I actually wrote a book called It Shouldn't Hurt to Nurse Your Baby. If anybody's interested in that, it's available on Kindle. It's not expensive. And it's the link is in my bio. It shouldn't hurt. I mean, a little tenderness and getting used to the sensation of a suckling baby. But cracked and bleeding nipples, not normal. And the other thing about that, Karen, is what we know is that's not just about mom, right? Forget all that we just said about the bonding and the pain and the physical problems with it. If it hurts, it means the baby's not nursing efficiently.
Right. So
the baby's struggling. So it's a sign of the baby's struggle when the mother's nipples are that bad. So
absolutely.
So what did you do then?
So we ended up after that, I kept pursuing it because I knew something's wrong. It's still hurting. I'm really. I went and saw. I don't remember exactly how I got to this particular provider, but I ended up at a oral surgeon who pulled his scissors out of his the little sterile pack, stuck in his, flipped it, and it was done. I don't think it took more than a couple seconds. And my husband's thought we could have just done this at home.
Yeah, right.
Obviously didn't far enough back.
Right. But it gave you some relief.
Right.
I think some more mobility.
Right. I think that was probably 8 or 9 months in.
Wow.
And he had all the telltale signs. Now looking back, he has a very high arched palate, narrow mouth. He's going to need a palate expander later. But you can tell it's not even a subtle tie. It was significant. Yeah. So it was something I looked for when I had my next baby, and he was born at home, and I had home birth midwives, and they checked right away. It was part of their whole head to toe newborn exam. And they said, hey, he's tongue tied. It was I forgot, is it graded or staged?
I don't like to use the numbers because there's different, it gets really confusing because the two different classification systems, for one of them, 1 is the worst, and for another classification, 4 is the worst.
Okay.
So I like to describe where it is. So if it was very severe, it was probably anterior, probably towards the front.
All the way to the tongue. So he stick his tongue out. So they referred me to a laser dentist right away, someone that they'd worked with a lot, but couldn't do it until he was a week old. And so a week, a painful week. That was rough. But
and how long between those two babies? Like, were you healed yet?
I know, barely. And like I had only weaned the other one, the first one. He was I probably weaned him around 15 or 18 months.
Right.
And the my second son was born 2 years. They're 2 years apart. So I had just a few months. And
that's back-to-back trauma and pain.
Right. And I think because I was so close in weaning and having the next baby, I don't think I was paying attention to nourishing myself and recovering after pregnancy, postpartum, breastfeeding. The baby who was he was still eating every 3 hours.
Right.
So I think I was a little bit undernourished. And so I don't know if that contributed to my, micronutrient status when I was pregnant with him or not. But So
that sounds like a segue into what you do now as a nurse practitioner, right?
Right.
It sounds like you've taken that experience and you are dedicated to helping women make sure that they are nourished in the postpartum period, right?
Absolutely. And nourished in the conception period too. People, not everyone seeks out that kind of advice, early when they're trying to get pregnant. They think, oh, I'll see someone, when I get pregnant. But that preconception time is so important for nourishing and, getting into the optimal nutrient status, not just for mom, but for the father too. So that even when you have a probably genetic predisposition to tongue tie, that you're doing everything you can nutritionally to support the body to have prevent like neural tube defects, and then also midline defects, with cleft lip and palate.
But, the other thing that also is there, the issue of milk supply, and like your kids did okay because you had a great milk supply, even if you weren't at your top nourishment.
Right.
But I see so many parents who come to me early postpartum, and their milk supply isn't good because they are so depleted,
Right.
you know, and, you know, talking about not just food, but making sure that, like, as you said, the micronutrients, the vitamins, vitamin D, they're anemic, they're low iron, and all of those things we can start in the preconception time and actually helps fertility, right?
Absolutely.
Yeah.
Absolutely.
I mean, it sounds like we're getting off the topic of tongue tie, but we're not, because you want to have a copious milk supply if you have a tongue tied baby, because that will help get things over the hump, right? So the other side of things is people whose babies are not gaining, and you know, that's the sign of tongue tie. So it can go either way. It can go either way with milk supply and with weight gain.
Absolutely. And I was just real motivated because of my experience. And I said, I do want to have more babies, but I want to do everything I can to set myself up for success. And maybe if they're still going to have it, maybe it won't be as severe, or I just want to do anything I could to prevent it from happening again for their sake and also for both of us.
Yeah. So I mean, there's not so much research that's really, dependable about the connection.
Right.
Of, you know, to me, it seems like everybody has tongue tie now. I mean, I only see people having problems. So of course it seems like everybody has tongue tie. It's rare. But I did have a baby a couple of weeks ago that did not have tongue tie. I came to my office, mom had some concerns, and there was no tongue tie. It was beautiful, very functional. And I was like, wow, not every baby has tongue tie. But, you know, when we talk about, for those who don't know what we're talking about, the midline defects and the processing of methylfolate, and that's a genetic condition involving the MTHFR gene. And some people can't process folate or have a problem with that metabolism. And there's a theory that those people are the ones who will have defects such as tongue tie, and then going all the way down clefts and other midline defects like spina bifida, neural tube defects. But there's no proof to that. And I don't have the defect. My kids don't, and two of my kids are tongue tied, and I was too.
Yeah.
So it's something. It's like, it's not just your genes. It might be part of your genes, but it's not just your genes.
A research gap, I think. There's so many more kids having it, I think, or maybe we're just getting better at detecting it. But, it's definitely a research opportunity to find out, improve that.
Absolutely.
So, yeah.
So then you got the laser procedure, and how is that baby? How were things with that baby after?
Oh, his reattached quite a bit. His, I think, was a lot. He also had a posterior tie. It was just really severe all around. And I don't know at the time if they got as far back as they needed to, because afterwards I still had some issues with latching, and he just didn't want to stay latched. On. He would be off and on, like a distracted toddler, like a 1.5-year-old might nurse. And so had getting too much milk.
So did anybody talk to you about other therapies?
No.
Any mention? So, because if I knew you then, I would have said, let's do some body work. Let's see what else is going on. You know, some either chiropractic or CST or something that will get the baby to get those muscles at a better state, even before the procedure, if possible.
Right.
You know, or if not before the procedure because you were in so much pain, then immediately after.
I would have absolutely taken advantage of all those, because I was in Dallas at the time, and there are lots of practitioners in Dallas and Fort Worth that things, sacral therapy and all those things. And we're in a small town in Nebraska now, so we don't have as much access to those. But we do have good chiropractors, and I am a huge believer in body work in general for not just.
Yeah, I find that the babies that have chiropractic or any kind of body work that addresses their tensions do better with the release and have less reattachment. Again, there's not a lot of research to that, but it's experiential. And most of the people that I talk to who do this kind of work see the same thing.
And it's a risk, high reward intervention. You know, you're not losing anything by trying it. It doesn't work.
Exactly.
Get a nice massage.
Exactly. And then we release the tongue, but the baby has to learn how to use that tongue.
Mm-hmm.
Right. So that's why it's not always a quick fix, and why you might not have had everything be, all sweetness and roses right after the procedure. Right.
Yes, I definitely should have had a lactation consultant working with me right afterwards. And I did see one, she came by once or twice afterwards, but I definitely felt like I needed more work with him, training his tongue. We did that, whether it was a lack of me being able to find them or just a lack of people doing that in the area. So,
right. And the lack of somebody explaining to you the whole process, right?
And so that didn't have any follow-up with me. He was just kind of like, we did it, now you're done, here's your stretch.
Right.
That was it. And my next two babies, we've been working with a laser dentist in Nebraska, and he is wonderful. He's very educated guy, and works with a myofunctional specialist, and requires people to see someone beforehand to prepare and then afterwards, especially with the older kids that can follow.
Right. I was going to say myofunctional therapy. There are some myofunctional therapists that see babies, but that's not really in their scope.
Right.
Unless they are also a IBCLC. I want to just explain that for the people who are listening, that myofunctional therapy is something that you have to actively do exercises for. It's not a passive thing. Right. But very important for older kids. And, while I say that the IBCLC is someone that the newborns, the infants should be seeing, once they're past the toddler stage or they're having trouble with feeding, it should be a speech language pathologist guiding the care who's trained in oral facial myology. Right. So there's different specialties that take care of different functional stages of the life, right? So
definitely a team effort.
Absolutely. Team tongue tie all the way.
Yeah.
So now that's baby number 3, and 4 the same?
So 3, his wasn't as severe.
Okay.
Wasn't having as much pain nursing. He was gaining weight. He's my biggest baby. Noticed that there was some element of tongue tie, and I should have had it fixed as a baby, but I didn't know, again, of any laser dentists in the area, and we were doing okay. He wasn't having pain. It was okay. I just knew we're going to have to do that at some point. He also didn't sleep well, and then I noticed later, like just some breathing issues at night. So I didn't do anything with him as an infant. And then my fourth one had I would say moderate tie, but it was, she had the anterior. And again, didn't know if this.
You said she, now you got a girl too.
So 3 boys, girl. She's still the only girl. So she still had one. And then I found this laser dentist back in Dallas, and we had friends there back and visited. So at 4 months, we went and saw her, and she used the second one and the fourth one. They used I think it's called a geode laser. Okay. Diode. Laser dentist that we see here, the difference, but so she told me, I can't believe she's feeding appropriately, gaining weight with the extent of the tongue tie that she has. And I was like, well, I've been through 3 of them. So
right. Yeah. I'm glad you said that, because there's often people think that you can tell by how bad the tongue tie is by looking at it. And you can't, because it's a functional diagnosis. Absolutely. So she had better tongue function, even though it appeared to be not so good. Right. So when people post pictures for me and say, is this a tongue tie? I refuse to answer that. Yeah. Because they could look like a tongue tie, but if everything's working, then it's not a tie. It's not, because it's functional. It's not what it looks like, because the frenum is normal. It's normal to have an attachment. It's just where it's attached, how flexible it is, and if it prevents normal mobility and function. Yeah. Right.
Later with, how that, like with the posterior ties and just how tight it is, can't see. I mean, we can see the frenum, but sometimes we can't see all of the tightness, I guess, underneath, or not all the pulling underneath. And then the same buckle ties. All my kids have buckle ties on the top of them as well. And so I know that was their latch, ability to get their lip curled out.
Absolutely. So for those listening who don't know what buckle ties are, those are ties in the cheeks that prevent the mouth from opening wide, and it interferes with breastfeeding for sure. So yeah, the posterior tongue tie, that submucosal, the tie that looks like people will look and say, oh, it's just slight, and it doesn't look obvious for those who are just trained in the front of the tongue looking anterior tie, like we learn about in school, will often look under the tongue and say, oh, it's just a slight tie, which is kind of silly because those cause more difficulty often than the anterior ties.
Right.
You know, I just had a brand new grandson, and he had a posterior tie. Like people with the midwives that delivered him were like, oh, he doesn't have a tongue tie. And I was like, yes, he does. You know, and again, the weight gain was wonderful, but my daughter was having pain and he was popping on and off. And he's still, even though he's had the release, we're still working with him. He's seeing an occupational therapist. She's doing exercises with him because he was born, and I think position has a lot to do with things too. He was born very asynclitically. So his head was in the pelvis crooked, and he had molding coming out one side of his head. So he automatically was tilting, you know, and all of his function was going towards that side. So he did much better on one side than the other. So you may hear babies who nurse better on one side or the other. And women often blame their anatomy.
Oh, yeah.
Oh, yeah, that's my slacker boob, or my nipple isn't good on that side. But most of the time, it's the baby's uncomfortable turning one side to the other. Mm-hmm. So if anybody, again, if listeners have a baby who has any kind of torticollis, meaning it's hard to turn one side or the other, or tightness on one side, babies prefer one side more than the other, definitely body work before you think about tongue tie release, because you want to get everything functioning.
Absolutely.
Yeah. So now you're pregnant again.
Yeah.
Yay. Congratulations.
Thank you. I'm really...
And you're hoping that this time everything will be okay, right?
Yeah. Yes, but if not, I know now.
Right.
Times I have my resources lined up, which I think makes a huge difference in anxiety afterwards. You know, the first time I was going in totally blind and I knew nothing and I didn't know where to go and ran into a bunch of dead ends. But, you know, with a lot of things with postpartum, getting your resources lined up ahead of time, it makes a difference because it just takes the stress away. You don't have to, while you're in a stressful, depleted, tired state, try to do all this research and find the people that you need. Getting that lined up ahead of time is so helpful.
It's key. It's definitely key because you have a problem, but you're almost paralyzed to do anything about it. Early postpartum, you're just trying to survive. Most people, right? Some people are super women, but most people, we don't expect them to be able to do anything but feed the baby, sleep a little bit when they can, nourish themselves, take a shower every couple of days, right? You know, that early postpartum time, and especially if you have other children, right? Especially if it's in a pandemic time where not all healthcare providers are as available and there's not as many support opportunities available for young families now.
So I know that was really tricky in 2020, like people trying to, you know, get lactation consultants to their home, and I'm sure plenty were willing, but it was just a hard thing to know. Should I do this? Should I not? And having people in our homes during that time, I think
now most people went virtual. I did lots of virtual consults. I'm not a fan of it because I'm very hands-on, and it's very hard to examine a baby virtually. Even seeing a feeding is hard. But there are lactation consultants that are amazing at it and actually prefer it now because they got so skilled in showing the parents how to position the camera so that it can be observed and stuff like that. Yeah. But I mean, especially in New York City, nobody wanted to go into other people's homes. It was that the virus was such high levels, and you know, taking a chance, it just wasn't worth it because then you can't see anyone else. You know, get exposed. If you have possible exposure, way back then, you couldn't see other people because we didn't even know how it was transmitted in the beginning,
Absolutely.
Anyway, so
Yeah.
hopefully we're past all that.
Yeah.
So do you mind me asking you, are you planning another home birth?
Well, it's actually very sadly, home birthing, or for a midwife to attend a home birth in Nebraska is a class 4 felony. It is, which makes me very.
Wow. I'm so sorry. I'm sorry for all of the women there, and I'm sorry for the midwives there.
Yes, it's a rural state, and we the biggest cities are all the way on the east side, and then so you have a whole rest of the state, very agricultural, very rural. We have birth workers out there who want to work, who want to do the work. They want to, their families in farming, or they grew up there, so they want to be there and they want to do the work, but it's not legal, and so they're paying tons of money for OBs to come out and stay in these rural areas, and they don't want to stay there because they're not from there. They have no connection. They don't in the middle of nowhere, Nebraska. And so it seems like an easy solution to me, but it's, not, there's been lobbying and tried to fix it, but there's one hospital birthing center in Nebraska. So a couple groups of midwives throughout the state too. But there's a laser dentist that we've been seeing in Omaha, and he recently, within the last 6 months, revised my first 3 boys. I took them in because one of them face was changing a lot. I mean, like 10 is a growth spurt. So face was changing with teeth falling out, new teeth coming in. And then the second one I felt still had attachment and was having, is in speech language therapy. We could work with him on that better if his tongue could move. And the third one was having it looked like sleep apnea at night.
I was going to say, you mentioned airway before, and that's a component that a lot of people aren't aware of. That if the tongue is tied, it affects the shape of the palate, and the palate is the bottom of the sinus cavity. And then picture that in 3D going back. So if the palate is high, the sinuses are narrow, and the whole airway going back is narrow as well. Yep.
And I learned from this dentist that happens all in utero before they're even born. They have a high before they're born. Practicing those sucking motions, their tongue is able to get into the right position, and it shapes their palate that way. So that made a lot of sense. People told me afterwards that he had a high palate, but I didn't really think anything of it. But all revised with a CO2 laser, which was field laser. He wouldn't do tongue ties with the other laser anymore, that this one worked so much better, that there's less bleeding, there's less scarring, less reattachment.
I prefer a CO2 laser over the diode. I wouldn't recommend anybody to use
diode. I've been calling it geode.
Diode, yeah. That the diode is more. It kind of burns the tissue away, whereas the laser literally vaporizes it. It's kind of cool. I've played with CO2 lasers. They're fun. Wrote my name in a tomato with the CO2 laser. I've been to the labs where the dentists learn to use it. As a midwife, as a nurse practitioner, even you could do the procedure. It's within our license to do it, but I'd rather not. I'd rather send it because I have people to send to. I'd rather send people off. So if you were talking to parents, what message would you like them to know? What would be something that you wished you had known ahead of time so that we can help new parents that might be facing this for the first time?
I would say, like we spoke earlier about lining your resources up, even if it's your first baby, you have no idea how that baby's going to come out, what sort of anatomy they're going to have. I I always tell people to line up a lactation consultant or business I know there's storefronts now and services that have multiple lactation consultants. Just find them and make a little list or down to your friends or family and get those people ahead of time, and even call them and just say, hey, I'm a new mom. I don't anticipate having problems, but don't not anticipate it. What's the setup?
So you know what, Karen, I think everybody should see a lactation consultant if it's possible. Not even, there doesn't have to be a problem.
Oh, absolutely.
Right. So what I love is sometimes I see parents and I make a package for them. So we have one visit ahead of time when they're pregnant.
Yes.
And either discuss all about, it's like a mini class, all about what to expect in the first few days, and then a visit included within a week of the baby's birth so that we can troubleshoot what went on. It works really well for second-time parents because we can think about what happened the first time and what they want to do differently and how to do that.
Absolutely.
Because you can't do the same thing over again, expect a different result.
I got that advice to a friend of mine who had, she found out after her second child that she has, doesn't have, was it low glandular tissue?
Okay.
So she was having trouble with supply issues the second time, and she was just having a lot of anxiety with her third baby about what am I going to do? And I said, you need a lactation consultant now for the babies have a plan going forward. And I think that makes a huge
Absolutely. It's key, especially somebody who has some medical experience. And there are lactation consultants that specialize in the field of low milk supply. And that's one way you can work virtually because you don't really need to, that's a plan that you can have in place with virtual visits that can help you get ready and optimize things.
Right. And then just mentally prepare yourself, knowing that I'm not going to be stressing about how often I'm pumping or what kind of bottles I'm using or what kind of formula around. If you have written out, when that happens, okay, this is what I'm going to do. And did that and had so much less stress the second time around. I think that would definitely apply for tongue tie, getting those resources in place and then also your support in place and having your community around to, I'm going to be working on feeding this baby a lot and I'm going to be going to the lactation consultant or she's going to be coming here. I'm going to need help with my childcare. I'm going to need skills. I'm going to need someone to text me and say, you're doing a great job.
Yeah. So yes, you have a handout for our listeners, right? Tell us about your handout.
So when I contacted you about talking about this, the first thing that went into my mind is like, what did I want to know? And then what was helpful for me when I went through that? And it's a lot of the same kind of postpartum support type things, but some of them are more specific to tongue tie, as far as like having appointments and having the time that you need to take extra when you're learning how to feed your baby, with older siblings, things like that. So I kind of just put it all on a list and I separated it between, some people were close by and had time, they're kids out of the house or they were older and they could come and spend time with me. There were people who couldn't come because they had lots of little kids themselves, but could make something. And then they were far away and they couldn't come help and they couldn't make anything for me, but they could mail me things. And
that's great.
I kind of separated it like that so people could see where can I best fit this in. But a lot of times when a mom is going through difficulty with child, after she has her baby or with pregnancy and a lot of times people are like, oh, well, here's some things to take care of yourself. Here's, do a bubble bath or whatever. And those things are great. And no one's going to turn down a nice bath, but it's like, that's just one more.
That's extra. You're trying to survive, not take bubble baths, right?
Well, it was nice, but I still need to feed everybody.
Right. So you put together a handout that our listeners can download, right? And we'll put that link in the comments afterwards because I'm not that good right now. And for the podcast, I'll put that in the show notes so that people can download your handout all about how to get ready and how to have the support ready for you for postpartum, right?
Absolutely.
And thank you for putting that together.
Sure. I just, I got into the work that I do now because of partially my experience. And I just don't want women to have to go through what I went through in terms of feeling confused, and like I myself was the only person responsible for figuring this out, diagnosing,
Right.
finding the right treatment. And I don't want
Right.
to feel that way. And I don't want
And a little extra pressure on you because you are a healthcare provider.
right.
So people expect you to be able to know things and do things. I know that's my experience anyway. So we didn't talk about what our connection is. We have to give a little shout out to Dr. Aviva Ram, right?
Yeah, so I found out that Lisa was talking about tongue ties through our Facebook group that we have set up for graduates of Aviva Ram's Integrative and Functional Medicine, or Women's Health Integrative and Functional Medicine training.
Yeah, it's a mouthful. It's a mouthful, but it's a great, great, great class and program. I mean, I've just the people I've met through the program is amazing.
Oh,
but what we learn, and that's how you've learned to do your program that you run now too, right?
Right. Yes. So I had done my conventional nurse practitioner training, and then had a huge gap between that and going, and I had all my babies, and then I wanted to go back, but I knew I didn't want to go back and do what I was doing in school. I didn't want to go work in a clinic the way that I was taught to work in a clinic. It just wasn't aligned with all the things through having all these babies and learning to advocate for myself and get the treatment I needed and that my babies needed. And I just come across her articles and then her podcast, and then her class came up, and I was like, that's exactly what I need. And it was great. It was wonderful.
Yeah, it is a wonderful program. Okay, so Karin, I've taken enough of your time. It sounds like I hear little ones in the background there. So thank you so much for taking the time to chat with us today. I am sure that our listeners will feel that they are less unique. They will hear some of their story in your story or your stories, and be encouraged to find the support that they need, to persevere for themselves, and to stick with it when it's tough, because you did it and you did it again, and you came out the other side, and you've got great kids, and you feel good now, and you have a career, and it's all wonderful.
Right.
And we wish you well with this new baby. Maybe we'll have you on again afterwards and talk about what that experience was.
Yeah, I might be you.
Yes, absolutely. Give me a call. All right. Thank you so much for joining us. Take care.
Thank you.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Please subscribe to us on your favorite podcast app. If you enjoyed what you hear, we'd love it if you'd rate, review, and share with your friends. Check out the show notes for useful links about the topics we discussed on this week's podcast. Also, you'll find the ways to follow us on social media. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.